Hello. If your knee is giving up while you're walking and you're afraid and not sure what's going on, you've come to the right place. Hello, I'm Dr. Lin with Empowerment Physical Therapy, and today I am going to tell you what is going on with your knee. If your knee is giving up as you're either walking on even surfaces, going up and down the floors, and tell you what you can do. To give you some context about where this post is coming from, as I'm treating a 67-year-old grandmother who we're seeing for her low back pain as well as a little bit of hip issues. So we've been seeing her for her right hip and low back for quite some time. She's a gardener. She absolutely loves moving around, and she is someone who's on the move all the time. So we've had success getting her some relief, getting her moving, allowing her to garden again. And so the other day she had came in and she had asked me what was going on with her left knee. Now that we've been treating the right side, and we've kind of everything we do on one side, we kind of do to the other. And that's my philosophy because I want to make sure that both sides are even up by the time we're done with her. So she was coming in with left knee pain, completely different from what we were treating her for. But I had a chance to examine it and see what was going on. As a result of the fact that she was having low back pain and right hip pain, she was compensating and putting most of her weight on the left side. So over the course of a couple months, she unconsciously had shifted her weight to her left leg and more so her knee. And that was what prompted her to complain of knee pain on the left side. So I had a chance to examine what was going on, and this is very typical of someone with knee issues. It's probably the most common thing that goes, probably the first thing that goes wrong with a knee pain. What has happened with her knee, left knee specifically, is the fact that the kneecap has come out of the groove. And that is the reason why she is having knee pain and complaining of knee pain. What that means is, so we'll kind of go in terms of your anatomy of your kneecap. So imagine the tip of my index finger as your kneecap, and the groove in between my knuckles as your knee. So the kneecap sits right in the groove. As you straighten out your knee, that kneecap is going to glide toward your belly button. As you bend your knee, that kneecap is going to glide toward your toes. So the groove, when that kneecap is out of the groove, and it typically goes outside, toward the outside of the groove, what that does to the muscle and to your quad is that it gets tighter on the outside and then lengthen on the inside of your thigh. And what that happens is, now that it's tighter on the outside of your quad and lengthened on the inside of your thigh, it's creating a dynamic where that kneecap is out of the groove. So every time you straighten and bend that knee, it's going to glide out of the groove. And that, over time, if you have a sudden or quick movement, that gliding sometimes will kind of click and get out of the groove. And there's that quick feeling of that kneecap coming out of the groove completely. That's what you feel when someone says, I feel like my kneecap or my knee is given out or will give. That's essentially what they mean when they say my knee is about to give, that the kneecap sometimes will get out of the groove. And when that does, that's when bad things happen. So what you could do, what you need to do is to reset and loosen up the outside of your thigh and strengthen the inside of your thigh so that the kneecap can go back right in the groove when it's bending and straightening out. A couple things you can do is, one, you got to re-educate the muscles. You got to reset the systems, and then you got to reload the systems, and then you reinforce that new behavior. And that's exactly what we do to kind of get that kneecap realigned. A couple things you could do momentarily to get some immediate sort of stability in that knee is to taping sometimes help to kind of pull that kneecap toward the inside within and along with re-education. That's what we'll do. Sometimes you can have a sort of a sleeve. You can put on a sleeve to help keep that kneecap right in that groove when you're doing that. So overall, if your kneecap is giving away, have somebody take a look at it, look at the root cause of the problem, and see what's going on before you do anything. The first thing that I like to do when someone complains of something is I'm going to assess it, and then I'm going to treat it, and then I'm going to reassess and figure out what's going on. So a couple of things you can do at the moment is to figure out what's going on, get to the bottom of it, reset it, reload, and reinforce. A knee sleeve is a quick sort of patch on a bullet wound, so to speak, to kind of provide some stability in the meantime if you're in a pinch. So again, if your kneecap is giving away, what that means is if your knee is giving away, it means that kneecap is probably out of the groove and is not in alignment with the rest of your body. That's why it feels like you're giving out when you're kind of doing quick movements or going down the stairs or going up the stairs. All right, so if you want to be empowered with the tools, mindset, and tool sets on how to recover from injuries, stay mobile and independent for many years to come without relying on painkillers, injections, or surgery, come join us. Until next time, take care.